Alright everyone, so I just left week 3 from my residency in the neurocritical care unit. I have not yet to hit the floor. That's going to happen for us in the next following 2 weeks. Just to say, I guess, how this experience has been going is overwhelming. I know I'm smart and I did very well in school and I know how to use my resources, but this program that I am in is kind of like nursing school 2.0 on steroids. It is very intense. It requires a lot of focus, a lot of time management, and with those qualities that I'm mentioning, like, we haven't even hit the floor yet. We've been doing a lot of modules. Some of it is new information, but a lot of it is old information from nursing school. To those fellow nursing students that are in their programs right now, please do not read to memorize. Don't study to memorize. Please retain all that information, because I promise you, if you do want to do critical care, all of your med-surg classes, health assessment classes, fundamentals, and your critical care nursing class will definitely apply. And if you can remember a lot of those lab values, a lot of those disease processes, it's going to help you to put everything together into a bigger picture when you are starting with these residencies, if you're wanting to do ICU. So that's a huge advice that I have for nursing students right now that are in that pathway of leaning towards critical care. This has been super overwhelming, and I can't say that word enough. I know I've repeated myself saying that, but that's like the best word to describe the feeling that I have right now inside my chest. I almost question myself, is this what I want to do, critical care? But I really can't see myself doing anything else, because I do like to be challenged and I like to use my mind and investigate what else is going on with my patient. And like I said, even though I haven't hit the floor, I still feel like this. So I know in the next following 2 weeks, probably gonna, have a mini panic attack. But I think that once I start immerse myself into being with patients and actually going through the movements and applying all of the knowledge that I'm gaining right now within these couple of weeks, I think it'll actually ease my anxiety, so to speak, because I'm more of a kinesthetic learner. I do learn a lot by reading and repeating and writing down. But with the amount of modules that we're doing, with the amount of in-services that we're doing, and in-services are basically these people that sell these devices to the hospital and that we use them in critical care. So with all of these things circulating right now, as a new resident, it's overwhelming. So any nurses out there that are in the ICU, even neurocritical care, please give me some advice. Give me some pointers, like, what can I do to really be prepared, I guess, for my first day on the floor with my preceptor. I know asking a lot of questions, I guess reading up on things that you don't know will help. I know those things, but anything else, like any other pointers that you think will help me as a new graduate to really make the most out of my day, I guess I can say, because I just found out that if you're not cut out for it after the 3-month point for our residency, the one that I'm in at least, they have stopped extending the residency, meaning you will get cut, you will get sent home, and you got to go find another job. My heart dropped a little bit. I know that's not going to happen to me. I want to make sure I make the most out of my first day on the floor with my preceptor, and for the following days after that and the following weeks, to make sure when I hit that 3-month period that I feel as confident that as I can as a new graduate, in order to take on to my own patients and gain all that responsibility. Any advice, please send it my way. And nursing students who y'all are in school still, if y'all want some advice on exactly what I'm doing or better ways to prepare yourself while you are in school, please reach out, because I personally feel that although I felt like sometimes my program didn't prepare me as well as it could have for my ICU position that I'm in right now, I think what changed it, where I was still, top of my class and still got really good grades, I think what changed that for me was I'm a go-getter, and so when I would study, I would repeat, until like I actually understood concepts. So make sure you're going above and beyond if you're in school. It applies, trust me. It definitely applies whenever you are starting your first big girl job or big boy job. So again, Nursing students, reach out if you have any questions. Nurses that are on the floor right now as critical care nurses, please let me know what I can do in order to, like I said, optimize my very first day with my preceptor and from that point moving forward. If you like this video, comment below. If you have any questions or any advice, comment below. #NursesRock. Thanks for tuning in, guys.